Hello and welcome to Fertile Forward. I'm Sadie Minkoff with Sage Acupuncture, and today we are going to be talking with Kristen Lasseter, who is a doctor of psychiatry here in Austin, Texas, in private practice, as well as doing telemedicine throughout Texas. And I'm very excited to connect people with this amazing resource. So welcome, Kristen.
Thank you. Thank you so much for having me.
Yeah. And just as a way of introductions, would you mind speaking a little bit about your area of expertise, which is reproductive psychiatry?
Yes, I get that question all the time. What is reproductive psychiatry? And promise I'm not making it up. It's essentially treatment of mental health disorders around times of change in reproductive hormones. So, menstruation, menopause, obviously pregnancy, postpartum, pregnancy loss, and infertility as well. And it's not just women, so men also go through some hormonal changes, especially postpartum, which is something that newer research is showing. And so they are also um, vulnerable to having mental health disorders pop up around infertility as well as postpartum.
I actually love that we're starting to look at how this affects everyone. You know, we don't live in isolation. So, of course, it's really important to support the entire family and really get the word out to our whole community.
Right.
Um, so then what does reproductive psychiatry look like, or does your training look like that's different than general psychiatry?
That's a great question. It's actually something that is not yet taught in most residency programs and most psychiatry residency programs. And there's kind of this question of, is this something we're supposed to be teaching psychiatrists, or is this something we're supposed to be teaching OB-GYNs? And unfortunately, it kind of falls in this gap of nobody really gets the training. And I think that that is starting to change. So for me personally, it wasn't offered at the program that I trained at the time. So I actually requested to do an away rotation in Houston at Texas Children's Hospital, where they have a reproductive psychiatry clinic, and spent several months there training under Dr. Lucy Purrier.
Gotcha. So you're really bringing this medicine to Austin, it sounds like.
At
Has
the time, at the time, that was my goal because there wasn't anyone who was specifically trained in it here. But since then, there have actually been a few more psychiatrists who have come into Austin who have also specialized in this field. So it's really exciting that we're kind of developing this more in Austin.
absolutely, yeah, that's wonderful. Um, and and I know that it's a big question for on a lot of people's minds. Do people have to take medication when they come to you? And really, what does it look like to work with you?
So it's different for every patient, right? So some patients come to me and they aren't interested in medication, and that's something that I fully respect. And we work together more on therapeutic modalities that can help them with what they're struggling with. Some patients come to me and they have no interest in doing therapy, so we just focus on medications. And some patients really are kind of in between. They don't want to do therapy, or maybe they're already doing therapy with someone else, but they're not quite at the point where we feel like they need medication. So we just kind of follow along with each other and make sure that we're keeping a close eye on them as they're going through these big stressful events in their life. So I really kind of leave it up to the patient and what they feel comfortable with. I'm definitely not shy in giving my recommendation if I feel like it would be safer for them and for their baby or for a future baby for them to be on medication. But I ultimately leave it up to them in terms of what they feel most comfortable with.
Gotcha. And a lot of patients that I see are actually curious about the medication that they're already on and if it's safe to take while they're trying to get pregnant. So, of course, I send them your way, but can you address that a little bit?
Yes, that is something that I absolutely love when I have patients who come see me before they have gotten pregnant, when they're either starting to plan out what pregnancy would be like, or they're going through infertility treatments and want to know what's best for them and for baby, because we can kind of put together an idea of what is safe, what is not safe, what are things to look out for. And there are still a lot of misconceptions in other providers and other physicians in the community on what these medications do, for infertility, for miscarriage rates, what they're like taking in pregnancy, what are the risks. And it's been one of my bigger struggles in Austin, and trying to educate other physicians about the current research and what evidence there is behind all of these concerns. So I love it when they come to me early on, so that we can kind of talk about everything and really understand the research behind it, and what's real versus what's a myth that's kind of been there for a long time.
Right. Yeah, it's wonderful to have such an amazing resource as yourself, just because there is so much confusion and really not great research on many things, and so I find a lot of people are just scared to do anything, which isn't great for their mental health either, to be sort of paralyzed in that. But people really are concerned about all kinds of things, like, are essential oils safe, and which ones, or coffee, and I know that the data is varied on that. So is there anything that you feel like everyone trying to conceive should know about the pharmacology behind things that they might encounter in their day-to-day life?
That's a great question. It is tough because there's so much research out there, but then there's also kind of these older research studies that maybe weren't done really well, or we focused too much on because that's all there was at the time. And so a lot of misconceptions can come out of that aren't necessarily true anymore. And then there's also things that we just still don't know. So, in kind of day-to-day life with, like coffee, for example, in the past it was kind of believed that no coffee is safe at all. And now we kind of understand that, 1 cup of coffee is fine to have. And for some people, that's how they can get through their day. And so, if that's going to be beneficial to you in your work life, or in your home life, you have other kids around that you need to have that with, it's fine to use it. As far as medications, especially the medications that I use, the vast majority of them are safer to use in when you're trying to get pregnant, or when you are pregnant, than the illnesses that might come up if you're not on them, or the symptoms that might be there, even with the medication. So it's oftentimes just weighing risks and benefits of medications, but as well as other treatments that you might be receiving.
Mm-hmm. Yeah. And so what are some of the red flags, or just things people should look out for? So, and then when they know, what, it's time for me to seek help through this.
That's a great question. I think one of the big things that I always ask about that is more of a red flag for me is sleep. So, are you able to fall asleep easily, stay asleep well, or is your mind kind of getting in the way of that with, worrying about things or thinking about past stuff that's happening? And just also, are you still able to enjoy the things you normally enjoy? Are you feeling generally like yourself most days? If you're not, then that's kind of a red flag for me. Then something might be a little off, and then it might be time to look into ways to make you feel better, whether or not that's medication, therapy, acupuncture. It all kind of varies depending on the patient and their history and what they're currently going through.
Yeah. Yeah, absolutely. And do you see couples as well?
I do. I do couples therapy, with couples who are going through infertility, as well as couples who are maybe planning for pregnancy and want to get things organized and as best laid out as possible before the baby comes, or patients who are struggling after having a baby as well.
Gotcha. Great. And I know that you do telemedicine, which is, I just think it's such an amazing newer offering for people, in that it can work around their schedules. especially if you do have a new baby, it can be really challenging to get out of the house.
Huh?
And also for infertility, I think that it's hard to just go to one more appointment and do, I think just be out in the world with this anymore. So I think the comfort of your own home can really be wonderful in that. Is that your experience as well, that people are drawn to that?
Yes, exactly. So women who are going through infertility treatments have so many appointments that they have to go to, and you can only miss so much work. So sometimes it's nice to just be able to, pop on a video call while you're at work during your lunch break. Or I have some patients who will go to their car and we kind of have the session there. I have some patients who just work doesn't allow them to take time off at all, and so having that meeting during their lunch break, as well as patients who just live far away and can't really reasonably make it here,
Right. So you can see people all over Texas, is that right?
all over Texas.
That's great. That's wonderful. So I'm curious how you got interested in this field to begin with, as really sort of a pioneer in it.
Well, I initially thought I was going to do OB-GYN when I
Mm.
went into when I went into medical school. I before that had worked for an OB-GYN for a year and I loved it.
Uh,
And then I went into my clinical rotations during medical school and I realized how much I loved psychiatry, which was much to my surprise. I hadn't had any experience with that before.
wow.
And it was just so amazing. I loved learning about it. I loved all the patient interactions that I had. So I decided to go into psychiatry. And in the South, women's mental health, at least at that time, was not really a thing. And I think there was only maybe one or two people in the whole state who were doing reproductive psychiatry at that time. So I had no idea that was even an option. And when I went on my interviews, they were mostly in the Northeast and on the West Coast, where they're a little more advanced in their resources for mental health. And they would have entire departments at some of these really big academic places that were dedicated just to women's mental health. So I learned about it there and I was like, this is perfect. It's OB-GYN, which I love, as well as psychiatry, which I love, and kind of the combined package.
Gotcha. And you do some work in hospitals as well in Austin, is that right?
Yes, so I currently work as a consulting perinatal psychiatrist at St. David's North. So women who are there either pregnant or postpartum, and they're struggling with mental health disorders during that time. Sometimes their OBs will consult me to come and see them in the hospital and help provide them care. And then I'm also going to be start doing that at St. David's Maine as well.
So that would be something that the OB would initiate as opposed to the patient.
Right. Sometimes it is a patient request. Sometimes it's the OB, sometimes it's the social worker. It just kind of depends, but normally the OB.
Gotcha. But in your private practice, people can just contact you directly?
Absolutely. I get a fair number of patients who just refer themselves, and they do that through my website usually or through psychologytoday.com. But on my website, they can just go and click on request an appointment, and then we get back with them in usually one day, one business day.
Great, good. And would you mind sharing your contact information with us in your website?
Yes, so it is rpcaustin.com.
Great, good. That's wonderful. And if there's anything that you wish people would know about reproductive mental health or your work in particular, what would that be?
I think it's just not being afraid to get help. Even if you feel like you're doing great and you've just had a history of it before, that's a great time to come in and just start planning for things. It's actually the optimal time to do that. But even if you just have some of the symptoms and you're curious, is this normal or is this not? That's still a good time to come in, and that's a conversation we can have together. And we can also kind of go through what are the signs and symptoms to watch for mental health disorders that can show up around hormone changes, and what do we need to be looking out for, and how can we do other things that can help prevent that as well. If there's anything I could tell people, it's just not to wait, because that's when it gets much harder to treat, and it affects your life in a much more serious way.
Yeah. And I couldn't agree more. That is so important. And we know that this is a really hard road, so at the beginning, if we prepare and sort of lay the groundwork for a healthy process, that will do much better in the long run.
Right. Absolutely.
Yeah. So thank you so much for all of your wisdom and being such an amazing resource in Austin.
Well, thank you, and thank you for putting this together for women too. It's absolutely amazing.